This is the Board of Health, the September 7 meeting. Today's Thursday, September 7 at 4:32. We are opening this meeting officially, and I am Ino Mobizi, Director of the Board of Health, and we have in attendance Dr. Brophy, the Chair, and Mr. Fisk, member, and I turn the the meeting over to Dr. Brophy.
So I'd like to call the meeting of the Board of Health for September 7th, 2023 to order. The first item on the agenda is approval of the minutes from our August 3rd meeting. Mr. Fisk, any edits or changes? Otherwise, I'd accept a motion to approve.
Yeah, I make a motion that we approve as read. I don't see anything. Yep.
Okay. Yep. Okay. So that the minutes are passed as printed. Third item, next item on the agenda is the tobacco permit update. As far as I'm aware, the board is aware, our last meeting, the legal department had asked for a written proposal to come in from the attorney, the solicitor, that was for the solicitor for both of the properties, so that we understand in writing exactly what they're proposing, and for the law department to actually take a look at it. And my understanding as of right now, the law department has not received that information. Is that correct?
Yes, which I have the request that I have placed to with Mr. Nasrallah, the attorney. So we haven't received the anything from him yet.
Okay. So there's no action on this motion at this point. We're still awaiting the proposal, a written proposal coming in from the attorney regarding both licenses, and for some input from our city solicitor once that proposal is in place. So,
Great.
All right. Next item on the agenda is moving forward with the life science bio community and adoption of the NIH guidelines for recombinant DNA. At this point, I think we've done a lot of due diligence in learning about this. I think some of the recommendations were that we bring in a consultant to help us in sort of putting together the rules and regulations around this, and not to sort of reinvent the wheel, but to borrow from other communities or formulate our plan around the plan that's already existing in other communities. So. And when we left it last month, we had requested from the mayor the approval to move forward with the consultant. Right. So at this point, we've not received any feedback yet on that proposal. Is that correct?
Yes, that is correct.
Okay,
Madam Chair.
Right.
All right. Any questions, Mr. Fisk?
None here.
None. Okay. All right. Next is the sanitary health inspectors. They have been moved under, there's now a health sanitary inspectors service department that's within the building department that exists. I think this move was happening, I think, last meeting, but it's been formalized now, and all of the inspectors are over in that department. Is that correct?
As of July 1st, that's when they officially moved over.
Okay, all right.
I have a question about that now. So who is in charge of them? Is the building department in charge, and they go out on behalf of the building department, or Dr. Montessor? Or?
Well, it's a little bit more involved than this, because some of there are issues that still falls under the purview of the Board of Health. For instance, just yesterday I received a request for a hearing on a particular issue, and so it could not be decided over there because under the Massachusetts law, it still falls under the Board of Health. So they forwarded to us for hearing, which we would haven't which the chair of the board would haven't attend today, but there was some technicality that they want to look into, the commissioner over there wants to look into. So therefore, yes, they are going for inspection, but there is a gray area where does health department jurisdiction ends, and where does ISD building jurisdiction start.
Mr. Vista, as they're realigning and reorganizing, these issues will come up because they haven't, all of the scenarios of events that could happen as they're doing this. And we're seeing, this is one of the first ones that we're seeing right now, where really the jurisdiction still lies within the board, yet the inspectors are in a different department. So I don't know where, the review that's happening right now, but, we may have to, based upon this, call a hearing, because legally it may fall under the board. We may have to deal with the issue, but I guess we're waiting to hear from the department chair and the review that's happening. But we're on hold for that at the moment.
So it's basically us a lack of knowing what's going on
Right,
at
exactly.
this time. Yeah.
Yes, exactly. Of the realignment and things that are taking place. Yes, exactly. So, I guess the next item on the agenda are some of the statistics regarding COVID.
Yes, thank you. Let me start with the today's stats. As of today, the last 24 hours, we've started with 10 no positive cases. And for the last 2 weeks, there have been a total of 70 cases, active cases. And then the total deaths, we have recorded one death in somewhere in the end of July, beginning of August. So that brought it from 536 to 537. And then the cumulative numbers, 34,647. Now, this number is a little higher, the cumulative numbers, because there are over 4,000 cases that are assumed COVID. So therefore, DPH is making the determination whether to revisit those stats and increase the number as actual cases or remove them. So basically, we are between 34,647 to about 38,000 at this time. So on the agenda, I did put what we had the past 2 months. So basically, we've had some uptake. There was also an outbreak, a cluster over 3 weeks ago at one of the nursing facilities. However, for some reason, it seemed that they handled it internally, and DPH was not quite able to make to design an event. What we call event, or DPH calls event, is to develop an official cluster with all the numbers, ID numbers for each cases. So, but we have no further information as to whether there were more people involved in it. At the point that it was reported to us, it was 14 staff. No, excuse me, 14 residents and 2 staff members. And then we continue to see the wastewater sewer. So that is one indicator that we still have. We look at it. So it still indicates that at times the numbers increase with, as we get closer to the flu season. Similarly, let me add that we have been receiving requests for flu vaccines. And so therefore, we are waiting to hear from DPH so that we can start the vaccination for flu. We do have a supply that we usually purchase ourselves, but it's only 50 doses. And it's quite expensive. So we try to rely on the state donation so that we can vaccinate the employees or the people within the city that are eligible to receive those doses, and then using the what we purchase to do other vaccination.
And I see that also you're speaking of vaccinations, as we read the inspectors, I sort of overlooked that you're still trying to hire, you still have a vacancy for one epidemiologist and new hire for tracking the cases, as well as vaccination changes to some of the COVID-19 vaccinations that we're expecting from the Mass Department of Public Health, some upcoming information regarding the new COVID vaccination, which is supposed to come out. My understanding is sort of end of September is kind of the time period that we, probably the earliest time period that we'll see the vaccine.
Yes, that is correct. So therefore, we are on a standstill until the latest information comes.
Yeah.
So in the meantime, what we have done in order to keep up with the demands, other demands on public health, we did send out two former case investigators into training. And so therefore, they have been working as community health workers to address other issues, including other infections that we see in the city. So along with the nurses, we do DOT for TB cases because we have an uptick in the numbers. And I think the uptick, basically, there are three explanations for that. Basically, we are out of the pandemic. And so people are more active, more social, interacting with other folks. Number two, we have less precautions. People take less precautions now when wearing masks. So mask is almost non-existent. And then we do have increase of individuals who migrate also from many different parts of the world. So that affects the number of the TB cases that we see. And so therefore, the nurses follow them up. We have the protocol that we have. Basically, they do some of it remotely, but other time they have to do it in person. And then the two community health workers, they also work to support what the nurses do. But all of that falls within the protocol co-sponsored by the Department of Public Health.
And can I ask, because the nurses now they've increased work because of the TB activity and the direct observed therapy. So this is, daily you have to be able to observe this. And coming up on vaccine time, they also give the vaccines out. Are you adequately staffed nursing wise to be able to meet the demand that you're expecting?
More or less. I was a little bit short for the past 2 weeks because one nurse went to vacation, and so therefore I was left with two, and then the two community health workers. But today the other nurse came back, and so therefore we are going to continue to meet the demands.
Yeah. And when the flu vaccines do arrive, how are you planning on letting the public know, or what type of information will people be looking for moving forward?
Basically, we work with the mayor's office. We post some of the information on the city website, and also we send the information to the community, Council on Aging. We also send it to the other departments so that they're aware of that we're offering flu vaccines. And we also share that information with the high rises, low rises within the city.
Okay, great, thank you.
Okay.
Any questions, Mr. Biss? Or?
No, nothing here.
Okay, all right. So, well, hopefully the new vaccine will arrive around the same time as the flu vaccine being released, because folks can get them together, and it could be a single visit. So, your clinics will be doing that, right, for both flu and COVID for those individuals that want to get both.
Yes, and anybody who's interested in doing that way.
Right.
I know
Okay.
some folks, they feel that they don't want to get two vaccines at the same time, but
Right.
we're open to doing that.
Yeah, I think a lot of people are waiting to get their booster, to get their flu vaccine until the new booster comes out. So. I think we covered the TB stuff, and some of the health promotion stuff as well. Anything new on the health promotion issue or public health?
We
issues
continue,
within the city?
yeah, we continue to work with DPH. We address some of the issues with them because as part of as the Board of Health of Brockton being part of the 14 largest municipalities, we work together, we'll address some of the issues. And so homelessness continues to press very hard. Mental health continues to press on the needs. Also, there is the issue with resources for the new migrants. For instance, some of them, they are placed in hotels, in different shelters here and there. And so that is one of the issues that I have been following closely and work with DPH to address it. And so therefore, with whatever resources that we have here, we try to meet the needs and then be sensitive to what the city residents need and how to really find where to bring the resources into the city to help alleviate the needs.
So,
Okay.
thank you for all that work. I mean, this is on top of, as you said, coming out of COVID, a lot of issues from the city in the health department needs to deal with and being sort of the broad scope of public health needs within the city. So, and I see you point out here that to remind folks about the new National Mental Health Emergency Hotline Services, which is 988. For anyone having an emergency, that number is now active and being posted in as many places as possible so that people are aware of it.
Yes.
So, you're continuing to promote the public, the community health needs assessment within the city as well.
Yes.
Yeah.
Yes, in fact, that's one of the reasons we have the need for the epidemiologists because those that we have up till June 30th, we had to let them go because of the new year and the low cases of COVID.
Right.
But we still have the need to revisit what's needed, and so therefore we do have the need to look at the market for one epidemiologist who would be able to work with us and help meet the needs of the city. So that's where we are right now. And I'm hoping that I'll be able to get the green light from the city in order to be able to place that job offer. And then see what we have.
And how are you doing with surveys being returned? Is there?
We have a number of them, so we are close to 100 people who have taken it right now. So I think I would say that it's a small sample, given that we are a population of over 106,000. So once we're able to bring in a new epidemiologist, most likely he or she can push to have more people taking the survey and then do the data analysis in order to be able to see where the needs and the gaps are. And then we can address that.
You're able, because obviously it's 106 people, but 106,000.
Yes.
But it's households, really, right? Because it's really the way the questionnaire is set up is sort of set up for a household. So, and it is available, as you said, it is available with the QR code on the website, as well as I think a lot of people got them in the mail.
Mhm.
And you're using it also at the community, whenever you go out to community meetings, making them available.
Yes, at the different meetings that we go, different sessions,
Yeah.
the nurses are there with a community health
Yep.
worker
Yeah.
that encourage folks to take the survey, because once they download the QR on the phone, then they can just answer the questions very briefly.
And it's important information for you to make decisions on things regarding public health in the city and things that people feel they need, the greatest needs within the city are. So I encourage folks to if they haven't, to look at the Board of Health website and use the QR code. And if you're at any of the community centers or any of the places that the Board of Health are, those questionnaires would be available. So I guess the last few things are related to the Brockton Hospital for folks in the area. Any further updates for the community about recovery of the?
Yeah,
system?
I've missed the last meeting. So because I had another constraint on my schedule with DPH, so I did not attend that one.
Okay.
But the news is that they continue to address it, and it seems that incrementally they will continue to open some services. And the latest I know is that they were looking to see if they could possibly open a good section of the hospital by December. But there's a probability also that it may be early next year.
Okay. That's the inpatient part of the hospital, because I know they've opened some of their clinics.
Yes.
Right. Any questions, Mr. Fish?
No, none there.
So still on a timeline though for hopefully the end of this year and beginning of next year,
Correct.
which has been the
Yep.
timeline we've been operating under for a while. Okay. And any further information on the medical advisory committee about tuberculosis that you attend? Or?
Actually, the city had a meeting with last Friday.
Okay.
The mayor has called for a meeting with the other with the providers, and so the first meeting took place 2 weeks ago to the date of tomorrow. But the second meeting, which was last Friday, DPH attended it because we have extended an invitation to them to attend and give some explanation or detail, because we are following about 10 cases.
Right.
So there was some major concern that talking about whether we have an outbreak or crisis. So DPH attended and says, no, it's not an outbreak, it's not a crisis, but because we transition from COVID, so we are seeing more cases now because people are coming out. And so therefore, we are looking at all those cases and they're not related.
Okay.
And so therefore, that I think that calmed down the temperature.
Okay.
With the concern that some of the people thought that we're heading to a crisis or an outbreak. So I think hopefully tomorrow we will have another meeting again. But the nurses continue to do their due diligence, as well as the community health workers did too. Now we may also increase our community health workers by one more to be linguistically competent.
Okay.
We have one that speaks Cape Verdean Creole and Portuguese, one that speaks Haitian Creole, and we need one who is fluent in Spanish as well. So we're looking to increase the community health workers by one more, and then one EPI. So that would be 2 positions that we would be looking to fill. So therefore, that would help to address not only COVID and TB, but any other health hazards such as any other communicable disease.
Just for your understanding, this, the observed, therapy, this goes on for months.
Right.
That these people have to be treated. So, and you don't want them to start therapy and then stop, because that's what breeds resistant tuberculosis. So it's very important that once you start the medication, that you complete the course of the medication. And, the direct observed therapy is the standard of care, and our nurses have to do that. And then if you have 10 cases, we usually would have one, maybe 2 cases within the city, but now, you have 10. But it's good to hear that it's not, that it's spreading, that the Department of Public Health feels that it's just individual cases that are occurring. But you also have to stay very diligent, because there could be an outbreak from one of the cases, and so there's a lot of work on the department to keep track of these individuals every day, during these time periods. So significant amount of work, and hopefully we're capping at 10, and we don't see further expansion of this. But it's good to know that the Department of Public Health is working with us and keeping close track of this with us as well.
Yes,
Right.
yes. Great service from the state.
Yeah. So I guess those are all the items. There were no action items on today. I think today's meeting was just an informative meeting.
Right.
There was pending the issue related to the tobacco licenses, and there may be an issue related to some inspectional services issues that may come back to the Board of Health. And if so, we'll be in contact about if a hearing before the board is necessary, based upon that incident. So our next board meeting would be scheduled for October 5th at 4:30, Thursday, October 5th. Any other issues or comments?
I've got none today.
So I would say we can have a motion to approve, to adjourn
Yeah, I'd make a motion that we adjourn until October.
until October. All right. Well, stay safe, everyone, and we'll regroup again in October. Okay.
Good enough.
Thanks.
Bye
All
now.
right. Thanks.
Amen.
Bye-bye.
Thank you.